What if I told you that you could begin supporting your blood pressure in a matter of minutes using nothing more than the air you are already breathing? No pill, no prescription, no cost whatsoever. And what if I also told you that the reason most people with high blood pressure never fully get on top of it has nothing to do with the medication they are or are not taking, but everything to do with a chain of events happening deep inside their body that started years, sometimes decades, before their doctor ever said the words high blood pressure to them? I know that might sound surprising, but stay with me today, because by the end of this video, you are going to understand your blood pressure in a way that most people never get explained to them. And you are going to walk away with a genuine, practical plan that you can begin using starting right now, today. I am Dr. Michael Chen, and you are watching Healthy Aging Insights, the channel I created specifically to give men and women over 60 the honest, clear, and genuinely useful health education that your body truly deserves. Today, we are talking about blood pressure, one of the most important health numbers you have, and one of the most misunderstood. Before we go any further, I want to ask you something in the comments right now. Are you currently on blood pressure medication? Or have you been told your numbers are creeping up and you are not quite sure what to do next? Drop your answer below, because I genuinely read every comment, and your responses shape exactly what I cover next on this channel. Now, let me start with something immediately practical and genuinely powerful. A breathing technique that some research suggests may help nudge blood pressure downward within just a few minutes of practice. Here is how it works. You breathe in gently and slowly through your nose for 4 seconds. Then you breathe out through your nose very slowly for 6 seconds. In for 4, out for 6. Back and forth continuously for 3 to 5 minutes. The key is making that exhale longer and slower than your inhale. That specific ratio is not random. It is the reason this technique works. And I want to explain the biology behind it, because once you understand it, you will be far more motivated to actually do it consistently. Running from your brain stem all the way through your heart and your major organs is the longest nerve in your entire body, called the vagus nerve. This nerve is essentially the master switch of your body's calming system, what physiologists call the parasympathetic nervous system. When your vagus nerve is activated, it signals your heart to slow slightly, your blood vessels to relax and widen, and your overall cardiovascular system to shift into a quieter, more settled state. And here's the key detail. Your vagus nerve fires most powerfully and most consistently during your exhale. When you deliberately extend your exhale and make it longer than your inhale, you are essentially pressing on the body's natural brake pedal again and again. You are manually activating the calming branch of your nervous system, and your blood pressure responds accordingly. If you have a blood pressure cuff at home, try this for 5 minutes and measure before and after. Many people notice a drop of several points just from this simple practice alone. And the beautiful thing is you can use it anywhere. Before a stressful appointment, in the middle of a difficult day, or simply as a quiet 3-minute morning ritual before you get out of bed. The second natural strategy I want to share before we go deeper is one that most people never connect to blood pressure at all. It is sunlight, specifically getting 10 to 15 minutes of direct morning sunlight on your skin on as many days as you comfortably can. When sunlight touches your skin, it triggers the release of a compound stored in the skin called nitric oxide. Nitric oxide travels into your bloodstream, where it signals the walls of your blood vessels to relax and widen, a process called vasodilation. Wider, more relaxed blood vessels mean less resistance, and less resistance means lower pressure. Beyond nitric oxide, natural sunlight also supports your body's vitamin D production and delivers infrared wavelengths that have their own beneficial effects on vascular health. People who spend the majority of their time indoors under artificial lighting are quietly missing out on these natural cardiovascular benefits every single day without realizing it. Without realizing, 10 minutes outside in the morning is free. It takes no preparation, and it supports your blood pressure in ways that are genuinely backed by research. Now, I want to go somewhere deeper because what I have shared so far addresses the symptom in the short term. And I genuinely care about helping you understand what is actually causing the problem at its root. So let me take you through what I consider the most important and most underexplained part of this entire conversation. Here's something that surprises many of my patients when I explain it to them. High blood pressure, by the time it is diagnosed, is actually quite far along a chain of events that began much earlier. Most people think of a high blood pressure diagnosis as the beginning of the problem, but clinically it is closer to the middle or even the later stages of a process that started years before. What typically precedes a high blood pressure diagnosis is a gradual stiffening of the arteries. Arteries that were once elastic and flexible, like healthy rubber tubing, slowly become less pliable and more rigid over time. And when arteries are stiff, they cannot expand and absorb the pressure of each heartbeat as effectively as they should. The result is elevated pressure in the system. There is actually a test called a pulse wave velocity test that can measure arterial stiffness and potentially identify this problem well before blood pressure numbers officially cross into concerning territory. Most people are never offered this test, but understanding that arterial stiffness precedes the high blood pressure reading is important because it tells you where to actually focus your energy if you want to address this problem at its source. So, what causes the arteries to stiffen in the first place? This is where it gets truly important and where most standard medical conversations fall short. One of the most consistent findings in cardiovascular research is the relationship between chronically elevated insulin levels and arterial stiffness. Insulin is the hormone your body produces to manage blood sugar. When you eat refined carbohydrates and sugary foods repeatedly over years, your body has to produce more and more insulin to manage the rising blood sugar. Over time, some research suggests that persistently high insulin levels may contribute to the stiffening and hardening of artery walls. Beyond arterial effects, elevated insulin also causes your kidneys to retain sodium. And when your body retains sodium, it also retains fluid. More fluid in the system means more volume your heart has to pump against, which directly contributes to higher blood pressure numbers. This is actually why one of the most commonly prescribed blood pressure medications is a diuretic, a water pill, designed to flush excess fluid out of the body. It is addressing a downstream consequence of a process that often started with chronically elevated insulin years earlier. Now, I want to share something about sodium and potassium that I consider genuinely important and that is rarely explained properly. You have probably been told at some point to reduce your sodium intake if your blood pressure is a concern. And while there is some merit to this advice, the conversation is incomplete without discussing potassium. These two minerals work together in your body in a delicate and important balance. Potassium helps your blood vessels remain soft, flexible, and relaxed. It counterbalances the fluid-retaining effects of sodium. Your body actually needs a significant amount of potassium daily to support healthy vascular function, and most adults over 60 are simply not getting anywhere near enough of it from their diet. Avocados, leafy greens like spinach and Swiss chard, sweet potatoes, bananas, beans, and lentils are all genuinely excellent sources of potassium. Rather than focusing exclusively on cutting sodium, prioritizing an increase in potassium-rich whole foods may be one of the most effective and sustainable dietary changes you can make for your blood pressure. And importantly, potassium does not carry the risks of low energy, muscle weakness, and disrupted sleep that can sometimes accompany overly aggressive sodium restriction. Let me tell you about a patient I will call James. He is 68 years old, recently retired, and came to see me with blood pressure numbers that had been climbing steadily for about 4 years. He was on one medication already, and his doctor was beginning to discuss adding a second. James was frustrated and a little frightened. He He told me he had been cutting salt, avoiding red meat, and trying to eat what he thought was a healthy diet, but nothing seemed to make a meaningful difference. When we sat down together and looked at the full picture, it became clear that several things were happening simultaneously. His diet was still high in refined carbohydrates, bread, pasta, crackers, and breakfast cereals, which were keeping his insulin elevated. He was sleeping poorly due to untreated sleep apnea. He had significant magnesium insufficiency that his regular blood work had never flagged, and he was almost entirely sedentary since retiring, having gone from an active working life to spending most of his days sitting. We did not try to fix everything overnight. We worked through these areas methodically over several months in close coordination with his doctor. A dietary shift away from refined carbohydrates and toward more whole foods, vegetables, and quality proteins, addressing his sleep apnea with proper evaluation and treatment. Regular daily walking that gradually built up to 45 minutes most days, and attention to magnesium through food and guided supplementation discussed with his doctor. Within 6 months, his numbers had improved meaningfully enough that his doctor agreed to reduce his medication dose. James told me recently that he feels better in his late 60s than he did in his early 60s. That is what addressing root causes, rather than just managing symptoms, can make possible. If you are finding this genuinely useful right now, please take 1 second to hit the like button on this video. It genuinely helps this information reach more people in our community who need it, and it takes almost no time at all. Now let me talk about magnesium, because I believe it is one of the most consistently underappreciated minerals in the entire conversation about blood pressure, and most adults over 60 are not getting enough of it. Magnesium plays a specific and important role in how your blood vessel walls function. The smooth muscle tissue surrounding your arteries contains calcium, and when calcium builds up in that muscle tissue, it causes the muscle to contract and tighten, increasing pressure. Magnesium acts as a natural regulator of this process. It helps move calcium out of the muscle cells of your artery walls, allowing those muscles to relax and your blood vessels to soften and widen. You may have heard of a class of blood pressure medications called calcium channel blockers. Their purpose is essentially to reduce calcium's tightening effect on artery walls. Magnesium supports a similar process through a completely natural pathway. Foods rich in magnesium include dark leafy greens, almonds, cashews, pumpkin seeds, black beans, avocado, and good quality dark chocolate. Pro tip that many people are not aware of: both chronic stress and a high intake of refined sugar actively deplete magnesium from your body. So if you are living with ongoing stress and eating a diet that includes significant amounts of processed or sugary foods, you may be losing magnesium faster than you are replacing it, even if you think you are eating reasonably well. And here's the connection I want you to pay very close attention to, because it affects a significant number of people over 60 and is very rarely discussed in relation to blood pressure. Sleep apnea. This is a condition where breathing repeatedly pauses during sleep, sometimes dozens of times per hour, causing your body to briefly come out of deep sleep to restore normal breathing. Each one of those interruptions triggers a stress response in your cardiovascular system. Your body interprets each episode as a physical emergency and responds with a surge of stress hormones and a temporary spike in blood pressure. Night after night, year after year, this cycle places an enormous cumulative strain on the heart and blood vessels. Some research suggests that effectively treating sleep apnea can result in a meaningful reduction in blood pressure, sometimes comparable to the effect of a medication. If you snore loudly, wake frequently during the night, feel unrefreshed after a full night of sleep, or experience daytime fatigue and brain fog, these are signs worth discussing with your doctor and worth investigating properly. Treating sleep apnea, if it is present, may be one of the single most impactful things you can do for your blood pressure and your overall cardiovascular health. Chronic stress deserves its own direct discussion because its effects on blood pressure are real and often underestimated. When you are under sustained stress, your body produces elevated levels of stress hormones, including cortisol and adrenaline. These hormones cause your blood vessels to constrict, your heart rate to increase, and your blood pressure to rise. In short bursts, this is your body's normal and appropriate emergency response. But when stress is chronic and ongoing, as it so often is in modern life, this physiological state becomes a persistent and damaging one. Stress also depletes both magnesium and potassium, two of the minerals most important for healthy blood pressure. Managing stress is therefore not a soft or secondary consideration when it comes to blood pressure. It is genuinely central. Whether your approach is daily breathing practice, regular gentle movement, time outdoors, meditation, meaningful social connection, or any combination of these, building consistent stress management into your daily routine is a legitimate and meaningful cardiovascular health strategy. Now, let me talk about some of the natural strategies that have the most interesting research support when it comes to blood pressure reduction. Regular physical activity consistently shows up as one of the most powerful natural interventions available. Even moderate regular movement like daily walking for 30 to 45 minutes can support meaningful blood pressure improvement over time. Your body was designed to move, and a consistently sedentary lifestyle alone can contribute to elevated blood pressure through multiple pathways. Exercise supports healthy weight, improves insulin sensitivity, reduces inflammation, supports better sleep, and helps your blood vessels maintain their flexibility and responsiveness. If you have not been active recently, starting gently and building gradually is entirely appropriate. Even 10 minutes of walking after meals can have measurable benefits. Garlic is one of the most well-researched natural foods in relation to blood pressure, and its findings genuinely surprised many researchers when they emerged. Some studies suggest that regular garlic consumption may support blood pressure reduction in a range comparable to regular physical exercise. The compounds in garlic, particularly allicin, appear to support nitric oxide production in blood vessels and help promote relaxation of vessel walls. Fresh garlic incorporated regularly into cooking or aged garlic extract are the forms most commonly studied. Hibiscus tea is another natural option with interesting research behind it. Several studies have suggested that regular consumption of hibiscus tea may be associated with a meaningful reduction in blood pressure readings, with some research suggesting a drop of several points in both systolic and diastolic numbers. It is widely available, inexpensive, and enjoyable as a daily habit. It is worth discussing with your doctor, particularly if you are already on blood pressure medication, as combining natural interventions with medication can sometimes have additive effects that need to be monitored. Warning, I want to be very clear about something important. If you are currently taking prescribed blood pressure medication, please do not adjust or stop your medication on your own based on anything you have learned today. High blood pressure that has been present for a long time can involve changes in the cardiovascular system that require careful medical management. The natural strategies I have shared today are best approached as additions to your existing care and as topics for conversation with your doctor, not as replacements for prescribed treatment. What I hope you will do is bring this information to your next appointment and have a genuine conversation about which of these approaches might be appropriate for your specific situation and how your doctor might support you in working toward better blood pressure through lifestyle alongside any medication you may need. Here is your practical action plan beginning today. This evening, try the breathing technique I described at the start. 4 seconds in through the nose, 6 seconds out through the nose for 5 minutes. Simply notice how you feel before and after. Tomorrow morning, spend 10 to 15 minutes outside in natural morning sunlight before doing anything else. This week, make one meaningful dietary change. Replace refined carbohydrate-heavy foods like white bread, white rice, crackers, or sugary breakfast cereals with whole food alternatives like vegetables, legumes, eggs, or quality proteins. Begin actively adding potassium-rich foods to your daily eating. Avocado, spinach, sweet potato, and beans are all excellent practical starting points. If you snore or sleep poorly, make an appointment to discuss sleep evaluation with your doctor this month, and build some form of regular, gentle movement into your daily routine. A 30-minute walk most days of the week is genuinely one of the most powerful things you can do for your blood pressure and your cardiovascular health at any age. You are not helpless in this. Your blood pressure responds to the choices you make every single day, and the body you are living in right now is more capable of positive change than you may have been led to believe. I have seen meaningful improvements in patients in their 60s, 70s, and beyond when they understand what is actually driving their numbers and address it with consistency and patience. That same potential exists for you. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health. If you found this video helpful, don't forget to subscribe to Healthy Aging Insights and hit the notification bell so you never miss a health tip. See you in the next video.